Welcome to another episode of AngioPod, the podcast for vascular fanatics. Today's discussion is not really educational, but rather an exchange of experience. I have with me today Dr. Kuldeep Singh. Dr. Singh is the Associate Program Director for the Vascular Fellowship at Staten Island University Hospital. He is also the Director for Limb Salvage Surgery. Also joining us today is our special guest, Dr. Marco Frascio. Dr. Frascio is a friend of Dr. Singh's. He is a professor of surgery at the University of Genoa. He is also the program director for the general surgery residency at the same university. Genoa was one of the worst hit places in Italy, so we decided to have a conversation with him about his experiences and the changes to the surgery training during this challenging time. A side note for our listeners, due to the challenges of recording the podcast remotely, the quality of the audio may not be the best in some segments, and I apologize for that. However, this is an interesting episode, so let's get started.
Okay, so this is a very nice surprise. We're lucky enough to be joined by Dr. Marco Frascio, who is the professor of surgery at University of Genoa. He's also the program director for the general surgery residency, and it was nice of him to bring along a couple of his residents. So with that being said, Marco, please introduce everyone that's with you.
Yes, if you like, I can introduce now my residents. They are four listening now in the podcast. Their names are, the first is Marta, that is coming from Ukraine. She is on the fourth year. The second is Ricardo Costa, that is on the first year. Third is Umberto Muschiato, first year, and the fourth is Sara Capoccia, Giovannini vien dalla Campagna, that is coming from Genova, and she is on the second year.
Okay, thank you for that nice introduction, Marco. For those that don't know where Genoa is, it's located northwest of Italy. The largest city close by is Milan. So this is an area that was hit pretty hard. And first and foremost, let us say that hopefully everyone's safe, you, your family, colleagues, and I know the Italian people are pretty passionate people, so I'm sure you guys will work through this. So with that being said, Marco, tell us your thoughts. How is it going over there? Are things getting better?
I have to say that my hospital is one of the most important in Italy. This is a hub in our region, and there is a very different kind of life during the COVID pandemic because the surgery level was quite doing nothing. Nothing is not true, of course. I'm not pulling your leg, but we have very, very low level of work because all the surgery was reduced to only neoplastic, oncologic, and urgency surgery. Because all the world, not all, but almost the world was transformed in COVID was. So that is that when there is the apex of the crisis that is in the March month, where they had to take off all the ventilator from the surgical wall to create a new ward of intensive care unit. So all the place we had in the hospital, the most part was devoted to the COVID ward.
And so when did that happen? When did it reach your hospital?
It's not difficult to say because in January we worked regularly, and in the second half of February we started to have news about the crisis is growing in Italy and in Genoa, of course, and all the month of March and still today we have only one surgery hall a day for normal surgery, and this kind of surgery was completely reserved to oncological and urgency. One odd thing that we notice is that in this period, apart some appendicitis, acute appendicitis or obstructed bowel, we did not have any entrance about the cholecystitis, diverticulitis, and so on. That were a lot part of the urgency during the day and also during the night. And we are just doing a survey to try to understand why. because we are just wondering if you were operating not ill people, but just, I don't know if it's possible to say that they were imaginary disease or what, but it's very unbelievable how many kind of surgery disappeared in this month.
Okay, so I don't know if our audience got that or not, but essentially what Dr. Fazio is saying is that most of the surgery has disappeared. Of course, the elective surgery has disappeared, and we have a similar situation here. But what he's saying is most of the emergent surgery has also disappeared as well. It sort of begs the question, where are these patients and why are they not showing up? Either they're getting worse at home or perhaps we were just over-treating patients. Hopefully that's not the case, but I guess we'll find out when things open up. These patients either will come back in a much worse situation or perhaps their conditions have resolved. So this may force us to rethink how we should be treating these patients. What's strange is even conditions like ruptured aneurysms, which we often treat, we have not seen these type of issues as well. These patients have disappeared. Either they've gone to different institutions or they're just not coming in. I spoke with a colleague of mine today. He's a burn doctor, and he's told me that even the second and third degree burns have stopped. Either patients are home and just being much more careful, or they're just not coming in because of fear of this virus.
Yes, it is so odd, peculiar. I mean, that I suggested to my colleague, in the Italian Society of Surgery, to try to get on a survey to try to understand why, and not only why, but also in which way and where this kind of patients went in this period.
Interesting. So where was the first area that the crisis started? Was it the north, south?
Yes. It's very easy because I thought that overall in the world, you know that, but because the first town was Codogno, that is in Veneto, in the region where is Venice, and after that the disease, the COVID disease, spread into Lombardia, and after that also in Liguria, that is the region around Genova, that is where we are speaking now. So the most part of the crisis have been in the north part in Italy. And still now in the south, there is very few cases. So because when the crisis started in the north, all the Italy was locked down. And so I think, not only me, but all the scientists, that this lockdown prevented the spreading also in the south and in the island of Italy. Do you understand?
I see. So it started in the north. Down south, there's not too many cases, but the lockdown is for the entire country. So you think would have helped a lot with it?
In the north, and especially in Lombardia, that is the region of Milan, we had a situation that unbelievable. The doctors had to decide who put in the intensive unit care, because we didn't have in this period sufficient places in the intensive care unit.
I see.
Let's get a perspective about the residents and how the residents are being deployed. Now that surgeries have been canceled over here, we've deployed the residents into teams of central line teams. Of course, the senior ones have gone into the intensive care unit. But how are you dealing with this situation?
Because it is important to say that the life of anesthetist, was very plenty of trouble and plenty of work. They are very exhausted. So they are taking also the last year of residence to work in the intensive care unit. About the surgical resident, we had in this period very, very few work, and so we asked them to don't come in the hospital all, because it is also dangerous. And they are doing some smart work at home, that is study, doing some simulation of cases and so on.
I see. So just so I understand, the senior residents, you are allowing them to run the ICU. However, the junior residents are mostly not working. They're at home.
Yes, and some of these were employed to work in the new COVID ward. That is of course is not a surgical job, but it was assistant in this new ward where there were, of course, few people in comparison with the number of patients.
Okay. You have there with you one of the senior residents?
Yes, they are not present directly, but they are present by means of an informatic platform. So, if you like, they can speak.
Yeah, that would be wonderful to hear their side of the story and get their perspective. A fourth-year resident or even one of the junior residents to see how they're occupying their time. I know the senior residents are in the ICU, so please, it would be wonderful to hear from them.
Yes, I call Sara Capoccia Giovannini Viene dalla Campagna. What is your experience, Sara?
Okay. My general experience during this pandemic was a strange experience because all cities in Italy was locked down during these 2 past months, and my normal routine wasn't the same in this time. All non-urgency surgeries was delayed in my hospital, and my department was closed because beds and nurses and other staff was used for take care of COVID patients. So me and my colleagues can go to the hospital only for emergency shift, and it was not a very good time because we can't have a possibility to be useful for our colleagues, anesthesiologists or emergency department, and for our patients. In other cities, in other hospitals, yes, some surgical residents was used in emergency department or in intensive care units for be helpful for other colleagues.
A reminder for our audience, we are doing this remotely, so please bear with us. I know it can be a little bit difficult to listen to everybody's voices, and the sounds can either sound too low or too high. But AJ, why don't you have, I know you have a few questions. I don't want to take up all the time, so go ahead.
Yes, Dr. Singh, I do have a few questions for Dr. Frascio and some of his residents. Overall, I do agree with the acute care surgery experience that we've been having. The numbers are significantly lower than what we had expected and what we are used to. That said, we have been really busy. Most of our residents are deployed in some sort of way to help patients with COVID-19. The senior residents are busy covering the critical care units, and the junior residents are a part of the access team, and this team is responsible for placing all sorts of lines. My question is about physician and resident physician well-being and wellness. The pandemic has been overwhelming emotionally as well as physically for everybody involved, especially the healthcare workers. What has your experience been?
I can answer in part because I have some colleagues and I spoke with them about the intensive care unit, and they were very exhausted, and one of the worst experience they had to do was about the triage I was speaking before, because the places, the beds, were not sufficient to the patient coming in the apex of the pandemia. So they have to choose which patient to place in the bed and which no. So this is similar to the triage that is used during the war, Yeah. And this is one of the worst experience. Another one is that all the patients cannot be visited from the parents, from the relatives. So all the patients that were going to death were completely alone, without any kind of relative assistance. And this is the second worst experience that my colleagues in the anesthetic said to me.
Yes, that's a very sad situation. We're dealing with this right now. Often a patient comes in COVID positive. Of course, we don't want others to get infected, so patients' families are not allowed to come into the hospital, and they're all often sitting at home wondering what's going on with their loved ones. So we have a similar situation here. The way we are dealing with that is, as we talked about, making up teams such as central line teams and ICU teams. We've also made a correspondence team where physicians are deployed to deal with patients' families. So we find out what's going on with the patients, and we communicate with the families daily. But it's a very sad situation when you don't know what's going on with your loved one. And Okay, so let me ask you about PPE. I know over here there was some shortage of masks and gloves, gowns, things like that at some of the smaller institutions, but overall we were able to handle these problems. Did you have these kind of issues with PPE and a shortage of ventilators? Tell us your experience.
But I can answer about my experience in the hospital. I mean, all the people working in the intensive care unit were quite good equipped about the individual protection and so on. In the other part of the hospital, we cannot say the same because the mask, for instance, were not so easy to find. So I can see that in the intensive care unit, everything was well equipped. In the rest part of the hospital is not the same, I'm afraid to say. Not now. Now it's quite good because now arrived the mask and so on. In the crucial period, also we experienced a lack of ventilator for the intensive care unit.
I see. So did you have issues with ventilators? Did the number of people there that were sick from COVID, from what's reported, astonishing. So was there a shortage of ventilators?
Yes, we experienced a shortage of ventilators, especially in the first part of the crisis, because the amount of people coming as patients, is so huge that we are not equipped in number of beds. The solution that we found was this. All the ventilators present in the surgical hall were taken and put in the new intensive care unit. So for this reason, this is one of the reasons that the surgical activity was completely stopped, because we haven't surgical hall.
I see. AJ, questions?
Yeah, let's talk about moving forward, since the graph is now starting to descend and the peak has already been reached. What are some of the steps that Department of Surgery as well as the hospital administration is going to take to, one, watch out for a second peak when the country starts to open? And in terms of the elective cases as well as the surgical cases that are now pending because of the COVID crisis that could not get done, what about those cases? What is the plan from your standpoint?
So the truth is now, sure, the crisis, the apex, is going down. We have now some places, free places in the intensive care unit, and we planned a meeting in the hospital about the surgical department, just to plan when we can start, of course, slowly. And we think that in May, in the second part of this month, in May, we can plan to go to the normality progressively.
Marco, as of now, the quarantine is still in place in Italy, at least where you are?
The quarantine, yes, is completely reality for the people who are ill, of course, or for people who are suspected to be ill by means of the test that we are doing now.
I see. And is there any talk of reopening even the South where the crisis did not hit as hard?
Yes. Now the plan is that after the 4th of May, we progressively open everything. Not everything, of course. The bar and restaurant, for instance, is not planned to reopen now, but progressively we think that we go towards the normality.
I see. Just a question about some of the medications. Since you were hit a little bit earlier, you may have a lot more experience. Were there any medications that you used, that antibiotics or anything like that you noticed that had some effect? Here, the big question in the U.S. is hydroxychloroquine, to see if that's effective or not. Are you using it there in Italy?
So I know that now all the medical class had understood that it's not only a problem of ventilation, but it's a problem of vascular disease. That is now all the people, or quite all the people, are coagulated. They take heparin and antibiotics, yes. And after they choose the drugs, hydrochloroquine, plaquenil, and so on, or biologic drugs, differentiated by the situation of the patient.
I see. So, yes, we are seeing a high rate of thrombosis, as venous mostly, but we also have seen a good amount of arterial thrombosis. So our patients are also on heparin as well. And I don't know if maybe I missed what you were saying about hydroxychloroquine, if you're using that or not.
Yes, they are. I mean, one of the main used now, hydrochloroquine, plaquenil, is one of the first line of treatment now.
I see.
And now we have in Italy, there are three centers that they are doing a trial about remdesivir.
Yes.
That is one drug that was employed in the arthritis.
Yes, I think we're going to have some information on that soon. There's some trials with that, but we don't know the results of that.
Yeah.
Anything that the residents want to tell us about their experience, how it's been? In terms of work hours, was there ever a time when the crisis was at its peak? Was there ever a time where you felt you were overwhelmed from the number of hours, number of patients, and just what's going on around you?
Okay. When the pandemic started, the life was a normal life. So I went to the hospital every day, and I worked there for all time, and my life was another life than what is there now. And 2 months later, we are changed person, I guess, because the lockdown was a very hard experience for me, for my family, for my patients, I suppose, and for my colleagues. And we hope in the first week of May, all come back to the normality, or quite the normality.
So I actually had one question, and this is not specific to surgery. It's specific to all healthcare workers. How is the morale of the healthcare workers? And I mean nurses, administrators working in the hospital, residents from anesthesia or critical care. How are they taking in the corona crisis because of the sheer volume and the amount of work?
If I can speak now, the answer is that in the first time, I mean the half of March, the morale of people is to be completely overwhelmed. I mean, it's very, very difficult to cope with the situation because nobody of us were prepared to cope one situation so difficult, so new, and so many people die. So it's very, very frustrating also for the old and more experienced people. Now, because we started to understand something about the COVID situation, people are more prepared, and some situation, because now the patients are going better and better. So it's not true that we see the end of the situation, but the number are less. We had new entry in the staff, so the situation now we can manage now the situation of today.
So, Marco, then, do you have some people, not necessarily from, in the healthcare, but just the general population? Are there areas where people are protesting to stop the quarantine, to come outside, to reopen? Are you having any of that situation? Did you have any of that situation?
This is now a crucial situation, crucial item to be decided, because everybody wants to restart, to reopen, to work. Economy, now is very down, is a crisis in economy situation and so on. So this is not only a political problem, but also economical problem. So everybody wants to start, to reopen, to go again to a normal life. But we know that the risk is a second wave. The risk is a new crisis. The situation is COVID is still now present. It's quite because the sensation of the people is as when you go under a sniper shot, So it's not easy to reopen. Also in the psychological level.
Yes, I can imagine. It's very, very difficult, and especially for people that are inside the house, they can't go outside, can't see their loved ones. It's a big issue. Okay.
I have to add one thing. I am really surprised in which way the Italian people comprised and also respected the rules to stay at home. It's very surprising for me.
Yeah, I guess people come together in these kind of crises, and that is nice to see, and it's nice that people are civil to each other, because these kind of situations can often lead to a lot of unrest and a lot of protest, and can become very bad. So that is nice to see, and that's happening here as well. Everybody sticks together to work through this problem. Any questions for us, Marco?
No, I think that you treated all the more important items about COVID in Italy now. I think that it's quite the same in your country. But your country is huge in comparison of Italy. So
yes.
Also the number of deaths is very, very impressive.
Yes, it's obviously a much bigger country. So yes, the number of deaths that is very high. But this New York area is hit very, very hard.
Yes,
but
if I can put a question, it's about perception, the sensitivity of the people about your president position about the COVID crisis.
Well, that's mixed.
If you can answer, of course.
Yeah, I mean, that's a very difficult question, but it's mixed. This is a very politically split country, so it all depends on who you ask. But, at this time, I think everyone is trying to just work through this and make sure that everybody is safe and healthy. Now, there's a difference of opinions, but I think everybody is trying to do the right thing for the people and also right thing for the economy, which in turn affects the people as well. So we're working through it, just like I'm sure you have the similar situation there as well. I'm sure there's split opinion as to when to open, which medications to use. There's so many issues to deal with.
Right. Very nice. Thank you for the answer.
Marco, thank you very much for joining us, and thank your residents. It was very nice of you guys to take out your time and spend some time with us and give us your thoughts. Marco is actually a friend of my friend Luca Maloney, who is a robotic surgeon at Brooklyn Hospital in Brooklyn, and he's the one that put me in contact with Marco, so it was very nice of him. Thank you very much, Luca. And thank you, everybody, for listening. We hope you enjoyed our podcast.
Yes, I thank you very much, and of course Luca as well. And it has been a good opportunity to exchange some opinion and situation. Also, my residents, thank you very much.
Well, that was an enlightening discussion comparing some of the similarities and the differences of first-hand experience of the COVID pandemic. If you enjoyed listening to us, do subscribe to our podcast and share it with your friends and colleagues. Our next episode is thoracic aortic pathology. Check in later to listen to that. Till then, stay safe. Thank you for listening.